This is a great question. I'd love to address this. Let's go over scars in general. Of course, if you have a scarring problem, you should probably see a dermatologist in person. There are a lot of mimickers that look like scars that aren't actually scars. They could be real conditions like lichen sclerosis or something else. But let's go over it briefly. My focus is on dermatologic surgery. I do a lot of procedures, so I care a lot about scars. I group scars into three different categories. We have your atrophic scars, your conventional scars, and then your overgrown scars. Atrophic scars are where if you put your finger over it, you notice an indentation into the skin. The skin may even be thinner and more compromised. You then have your conventional scar, which if you put your finger over it, there may be minimal texture changes. Maybe it's a little bit thicker than the surrounding skin, but not much. And then you have your overgrown scars, which are your hypertrophic scars or your keloids. That's where the scar is much, much thicker. There are other components to the scars, such as the color. Is it red? Is it pigmented? Is it depigmented? I'm not focusing on that today. I'm just focusing on the thickness of the scar. Hypertrophic scars typically develop from some type of injury, an acne pimple, a surgical scar, a cut on your skin, and they're localized to the area of injury, to the wound, to the surgical site, to the pimple. It's just a thickened scar. It may be itchy, it may be red, but it's not very far off from the initial injury site. These may go away on their own, but we can also do some treatment to help with them, which are kind of in the same vein as keloid scars. Keloid scars, on the other hand, are the very abnormal overgrown scars. They may happen from surgery or a pimple, but they may also spontaneously develop. We don't always know what causes the keloid to develop, but they're very thick, they're very wide, they're very broad, they look very obvious and abnormal. You can tell the difference between a hypertrophic scar and a keloid under the microscope. There are very clear differences. Hypertrophic scars have more fibroblasts and collagen, but it's more organized. It's parallel to the wound. Whereas keloid scars, it's more haphazardly organized. There's a lot of collagen, a lot of fibroblasts, but it's all over the place in large whorls and bundles under the skin. I'm going to be honest with you, keloid scars are hard to treat. We do a lot of things, and sometimes we have to combine a bunch of treatments because they are hard to go away. The most common thing you'll do with a keloid are in-office procedures. We usually inject it with a little bit of steroid. Sometimes we add fluorouracil. That's to help soften up the keloid, reduce symptoms. It will not probably make it go away, but at least make it a little bit better, a little less noticeable. Topical steroids might help in some situations. Some have talked about using topical imiquimod to help. The results are iffy. In some people, it may help. We're then moving on to surgical procedures for keloids. This is what I do frequently, especially on patients' ears or on the chest. Frustratingly, even if you cut out the keloid, there's a very high risk of it coming back. So you have to be very aggressive with it. Some people even do radiation treatment to the keloids. You will cut out the keloid and they will get radiation afterwards. Sometimes you'll inject steroids and fluorouracil after cutting it out as well. If it's on the ear, you can also do a pressure dressing. The pressure dressing kind of helps reduce your risk of getting keloids, but they can be very frustrating. I've had, at least personally, success with cutting it out and injecting a steroid afterwards, but there's a high risk of it coming back. So hopefully that's helpful. Just a brief overview of keloids and scarring. Have a great day, and don't forget to slap the cheeks. Unless it causes a keloid. No, it won't actually do that.